Funding for this edition of State of Affairs with Steve Adubato has been provided by the Robert Wood Johnson Foundation, the Northward Center, MD Advantage Insurance Company, the Russell Berry Foundation, Making a Difference, Johnson & Johnson, Valley Bank, ADP, Always Designing for People, Fedway Associates, Inc., and by the Adler Aphasia Center, enriching the lives of people with aphasia, their families, and communities. Promotional support provided by Jaffe Communications, supporting innovators and changemakers with public relations and creative services. And by CIANJ and Commerce Magazine.
Welcome, I'm Steve Adubato. We're honored right out of the box to be joined by Dr. Adam Jarrett, Chief Medical Officer and Executive Vice President of Medical Affairs, Holy Name Medical Center. Good to see you, Dr. Jarrett.
Thank you, Steve. Good to see you.
By the way, you can check out Dr. Jarrett on NJ Spotlight News on a regular basis. He's been giving updates as to where things are. We're taping on the 17th of November. This will be seen after. So put things in perspective for us. Let's assume this is seen in January. You cannot predict the future. But the vaccine issue, as we speak right now, game changer?
Well, I think there's reasons to be cautiously optimistic, but I do think we need to be cautious about it. The results from the 2 vaccine studies are still preliminary. They're encouraging, and until they're final, I don't think we can count on them too much, but it is encouraging. But I do think the bigger issue is going to be getting those vaccines distributed. So it's going to be a challenge to get them out just to healthcare workers. The hope is that that can be done by early next year, and then getting them out to the general public will likely take even longer. And so I think that we're still talking about getting people vaccinated well into next year. And we just don't yet know whether the vaccine is going to work. The evidence is strongly suggestive that it is. The evidence is strongly suggestive that it's safe. I'll feel better when those studies are finalized, and I'll feel better once we know we have a distribution method for the vaccines.
Dr. Jarrett, you've been with us many times, and one of the things I realized I've never asked you that I need to ask you now is this. On a human level, how would you describe what the physicians, the nurses, the respiratory therapists, the frontline healthcare workers are facing on a daily basis?
So if you go back to March and April, this was a tremendous challenge. Like really
March and April 2020, this will be seen early in 2021, so go ahead.
So going back to March and April of this year, 2020, it was nothing like I've ever seen. I've been in healthcare for over 30 years. I trained in the middle of the AIDS pandemic, but this was like nothing I ever saw. And what my staff and the staff at Holy Name and really around the country had to go through was absolutely devastating. The volume of patients, the rapidity that patients were coming into the hospital, how sick patients were, the fact that patients were relatively young, the fact that patients were not able to have contact with family, just the sheer stress of having to take care of that population and then be worried about yourself and potentially taking home this virus to your family, especially when we knew very little about the virus. It was really a very difficult time, although I was very impressed with how the Holy Name staff handled it. I think what we're feeling now in November, as the volume begins to increase again, is fear. Are we going to get back to where we were back in earlier in 2020? And I think there's that apprehension. The hospital is situated much better. We have our COVID dedicated negative pressure units. We have our PPE. We do have a handful of therapeutics that are somewhat beneficial, but not so beneficial that we're still not seeing significant problems. So there's some hope and there's less panic, but there is still real fear that we're going to get back to where we were earlier the year when we had almost 250 patients here and over 45 patients on ventilators. And we had over 250 patients die just here alone at Holy Name.
Again, the unpredictability of all this, taping when we're taping. My question is this. You mentioned therapeutics. What appears to be, and I'm going to double, I usually don't ask two questions in one, but I'm going to do this. What appears to be most effective in treating COVID, A, and B, does it largely depend upon the patient and his or her condition?
So the most effective thing is to not get it. I know you weren't asking that question, but masks, probably more important than a vaccine. But once you have the disease, we have two proven treatments now, remdesivir and dexamethasone. They're not magic bullets, though. We do think they have a small benefit. We do think they get people out of the hospital sooner, and in a very small percentage of people, they likely prevent them from getting critically ill. But we know now that despite remdesivir and dexamethasone, we are still seeing a significant number of patients get critically ill. The potential for the monoclonal antibodies, I think, is going to be bigger than the remdesivir and the dexamethasone. Those drugs are now becoming more available. We are giving them here based on a study where 2 out of 3 people who qualify for the study are able to get the drug, and the other 1 out of 3 gets a placebo. And that drug is going to be very available, likely in the next week or so, based on emergency access through the FDA. And I am, again, cautiously optimistic, because we still don't have definitive studies, that those medicines could potentially be a significant breakthrough, but we're just not there yet.
We're speaking with Dr. Adam Jarrett, who's been on the front lines of this COVID fight from day one. Dr. Jarrett, let's try a public policy question. New president, Joe Biden, again, this will be seen in 2021. Say his administration is committed to public health, committed to following, quote, the science, and listening to public health and scientists, public health experts and scientists. What should the federal government response to COVID look like? And how is that different from what we've had for the last year?
I think we need to be more open with the American people and talk about prevention. So masks and social distancing. I don't think we're at the point where we need to be talking about a national across the board lockdown, but I do think we need to be open to the fact that there's going to need to be strategic pulling back from opening. So depending on where you live, depending on the case rate there, we need to be more open to a 2 to 3 week or a 4-week pause. And then we need to open again and watch the case number. We need to accept the fact that until we have knocked out this pandemic, and that's different from knocking out the disease. We're going to be living with COVID-19 for years, but until we're not at the point where it's no longer a pandemic, we need to socially distance, wear masks, and be open to the fact that there are going to be times where society is going to have to shut down for short periods of time.
But hold on, Dr. Jarrett, you said living with COVID for years. If the vaccine, or the vaccines plural, prove effective into 2021, right? How could we be living with COVID for years?
Well, there's a difference between living with it as a pandemic and living with it as another disease that we just fight on a regular basis. So I am cautiously optimistic that by the end of 2021, and definitely into early 2022, we will no longer be in this pandemic state. But I also know that I will still, as a physician, be taking care of patients who have COVID-19. We're not going to eradicate this disease. We're going to get it to a point where we're not worried about it turning into a pandemic. But we still will see patients who come in with COVID-19, and we still will need to test for it, and we still will see some patients who get critically ill for several reasons. One, unfortunately, there'll be people who won't take the vaccine. 2, the vaccine will likely not be 100% effective. And 3, we still don't know for sure how long the vaccine will be effective. So we have not eradicated polio as a world. We've gotten rid of it in this country, but we have not eradicated it. We have certainly not eradicated measles. So these diseases are still with us, and the healthcare community needs to be ready to deal with them. But that is different than saying we're going to be in this pandemic state, which I believe we should be out of by the end of 2021.
I've been listening to and watching Dr. Adam Jarrett, Chief Medical Officer, Executive Vice President, Medical Affairs, Holy Name Medical Center, to fully disclose one of the hospital systems that supports our public policy programming, particularly around healthcare. Dr. Jarrett, I want to thank you so much for joining us.
Steve, it's been a pleasure. Stay well.
Same to you. We'll be right back right after this.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
We're now joined by our good friend Ginger Gold Schnitzer, Executive Director of the Guarini Institute for Government and Leadership at St. Peter's University, and also, as we speak, the Director of the Master in Public Administration program at St. Peter's. Good to see you, Ginger.
Great to see you, Steve.
Toward the end of 2020, it'll be seen in 2021. Biggest takeaways for you, big picture, in this historic election.
Gosh, Steve, we're making history for the wrong reasons. Like, we have just elected the first woman, the first African American, the first person of South Asian descent to the second highest office in the land. And yet the most historically significant aspect of this election may be the fact that the incumbent president is refusing to concede, and that he's blocking the transition, and that he may break with the time-honored American tradition of a peaceful transition of power. So that's one takeaway from me. Another takeaway.
Before you go any further, let's go to this. This will be, say it's seen in the second week of January 2021. Do you believe the president, as we speak, President Trump, it'll be President Biden after the 20th of January, that President Trump will say, you know what, all right, enough. I didn't win. I want to be helpful. Why are you making a face, Ginger? You don't think it's going to happen?
No. I'm hopeful that that's going to happen, because you know what? That's what's happened for over 200 years. And yeah. I believe at the end of the day, Steve, that's what happens. I think it's what the people demand. I think it's what the people expect.
But what about all those people, the 4 million people voted for Trump? Do you think the vast majority of them are saying, Joe Biden's not my president?
I think that changes with leadership. That changes when you stop getting the echo chamber of messages that have been coming at them, 24 hours, every this constant news cycle and drumbeat. That changes. And it also changes when you get other Republican leaders in Congress to stand up and say, no. In America, this is the way we do things, right? We transfer power.
But sorry for interrupting. I took you away from your other big picture lessons of the election. Go ahead, Ginger.
No, my other big picture is that voters hedged their bet in this election. They elected Joe Biden, but they didn't there was no, he broke the blue wall, but there was no blue wave, right? He didn't deliver them a Democratic Senate. Maybe it's yet to be seen. I know there's a recount that's going to, happen in Georgia. We'll look at those 2 Senate seats, but chances are probably not a Democratic Senate. And Republicans actually grew their numbers in the House. So that's my second takeaway. My question to you is, does this lead to more partisan paralysis? Or is this, there's an opportunity in this crisis, right, that maybe will usher in bipartisanship? Well,
I'm going back to you. Gridlock. Assume that gridlock, Democratic president, Republican Senate, the House is Democrat. We'll see. Say gridlock is perceived by some, if not many, on the Republican and some Democrats, that's in their interest. Let's not help the other party. Republicans say, let's not help Joe Biden succeed. What would that mean for the country?
That would mean more of what we've been seeing for quite a while, right? That would mean no change. I believe that when you have so many people coming out to vote on both sides, that there will be a change, that there will be that attitudes are going to have to evolve about this if we ever want to get something done, especially when we're living in the middle of a pandemic. We got, 240,000 Americans who are—
As we speak.
Right, and counting.
Unfortunately, the number will be higher when this is seen. Can we even agree on that, Ginger? Can't Democrats and Republicans, Trump supporters and those who supported Biden, can we just agree that this is the most horrific public health crisis we've seen in at least a century, and we need to come together? Can't we agree on that?
With leadership, we can. But right now, there's a vacuum of that kind of leadership.
Where's the silver lining?
The silver lining is, I think that so it kind of goes into my third takeaway, right? We had historically high voter turnout. So people are paying attention. And when people are paying attention, we have a chance that maybe things will be different. I'm a little cynical. Let me be cynical for just a second, though. I often wonder if that high voter turnout is because of engagement and participation in a healthy democracy, or if it's because of extreme polarization and mistrust, right? Now, if it's from sort of engagement in the democracy, then there's the silver lining, right? We're going to have more people fighting the fight and getting engaged and paying attention and becoming familiar. And we know that the more people that are paying attention and talking, that usually means better outcomes.
Hey, Ginger, if we continue with vote by mail, post-pandemic, and a significant number of people do not believe that the results are legitimate because of whatever, including, hey, you didn't count the votes in the machine. What does that mean for the functioning of a republic/democracy?
Let me just take the first part of that first, right?
Sure.
If we continue by vote by mail, right? Vote by mail is not a new idea, okay? Like absentee voting began in the Civil War for soldiers on both sides. And so the issue is, there are some who believe that vote by mail is just an opportunity for voter fraud. And then there's others that believe if you don't allow people to vote by mail, you're actually suppressing the vote. But it's not a new idea. In the 1800s, we had the first laws passed to allow people who were home or seriously ill to vote. In the 1980s, California allowed absentee ballots for no reason. You know, we had a referendum passed in Oregon not too long ago, allowing the state to issue ballots to everybody, which is exactly what a lot of states did because of the pandemic. So I don't think we can say vote by mail is what's causing distrust in institutions. I think, you know, there's always whenever you have a highly polarized election, whenever the stakes are really high, that's when mistrust grows. Now, if you want to talk about what that means, that's, you know, you can't have a representative democracy without trust in the electoral process. It's through this process that leaders receive the legitimate authority to govern. So if people don't trust the electoral process, they don't accept the results of the election. If they don't accept the results of the election, the winner's not seen as having any authority to govern. And leaders who govern without authority give voters reason to question the legitimacy of their government.
And what do you see as our role in the media to help facilitate the process you just described? Seriously.
So,
we want to be part of the solution. What should we be doing?
I think that we need to educate people on how to consume media appropriately.
What does that mean?
I think, well, to be able to understand what's opinion and what's a description of what's happening. There's a lot of opinion. Now, not everybody is a show like yours, Steve. You know, there's a lot of people that, you know, and also that social media is great because people read news stories and learn more about news from paying attention to social media. But on social media, there's no standard. Anybody can post anything and people will believe it. Don't spit in my eye and tell me it's raining. You know what I mean?
We can have different opinions, but to not be able to agree on the most basic facts, that's scary.
That is scary. And so, Steve, when when it comes down to it, it's not the media, of course, is going to help, right? But it's not just the media. We need a serious, early, lifelong commitment to civic education. I mean, that's the main mission of the Guarini Institute, and why I'm so pleased that the Masters in Public Administration program is now under the leadership of the Guarini Institute, because we need to train people how to do this work. We need to train public administrators and the general public on what the roles of institutions are in our democracy and the importance that they play. And we need stronger political parties, frankly, because right now there's too much reliance on individual sort of celebrities. You can pick them out in both parties.
And by the way, final thing on my end, democracy, definitely not a spectator sport, right?
No way. I've said that before when we've talked. Yeah.
Yeah, it's more true now than ever, right, Ginger?
More true now than ever. And everybody's got to play their position. In other words, Congress is there to legislate. The president is there to execute, to carry out the laws. The media is there to report what's happening. The Supreme Court, the judicial system is there to interpret laws. Everybody's got to stop thinking that this is just a platform for them to have a bullhorn to shout their opinion.
Ginger, I want to thank you for joining us. To you and the family at St. Peter's University, you and Gene Konaki and everyone there, we wish you all the best, and we'll look forward to talking to you soon.
Thanks, Steve. Thanks for having me on. Have a great day.
You got it. I'm Steve. That's Ginger. We'll be right back.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
We're now joined by the Honorable Stephen Fulop, the Mayor of Jersey City. Good to see you, Mayor.
Thanks for having me.
Taping on the 17th of November, being seen later. Big picture, number one leadership lesson you've learned in this COVID crisis. How would you describe it?
Well, I mean, it's been challenging. I think that, you have to be willing to make decisions and communicate them, over-communicate them with the public. And, we've been at the forefront of a lot of things regarding COVID response. I think the city's done okay overall, but, we're in the second wave now, so we'll see where it happens from here.
As we were speaking, we are in the second wave. Hopefully when it's seen multiple times, we're out of that, but who knows? Hey, listen, Mayor, how much of this do you see as your responsibility as the Chief Executive Officer of Jersey City versus, hey, we'll wait for the state, we'll wait for the feds to make decisions, as opposed to I'm taking the lead?
We'll take the federal government really hasn't been helpful. We got the initial CARES funding, and that provided some financial relief for us. And the governor and the state overall has been helpful. We've kind of butted heads in a couple different situations over the last year, but
I've noticed.
Yeah. I think for the most part, we and I think Governor Murphy has done a pretty good job on managing a tough situation.
Should you be allowed to legally to? So yes, anything I ask like that, you say yes. See, let me ask you this. Should you be allowed to make your own decisions as to restaurants, as to gyms, as to whatever in Jersey City because you know it best, or should that be state policy?
No, it should be state policy. There should be a larger regional approach. We see it in countries in Europe that are taking a national approach. That's not going to happen today. But the larger the geographic area, the better it is. It makes no sense for us to have a curfew at 8 p.m. and then Hoboken has no curfew and Bayonne has one at 9 p.m. I mean, that's counterproductive to everybody. So the larger approach is the best approach.
Mayor, how about schools?
Schools, I think municipalities can be a little bit more flexible because they know better what's happening in their specific communities. But we're seeing young people being the spreaders of this, even though they may be asymptomatic. They do take the virus home and infect other people. So I think limiting at this stage some of the in-person learning has been a actual good decision, although it's very, very difficult, particularly difficult for financially burdened families.
Police reform. I'll shift gears dramatically. We've been doing an ongoing series called Confronting Racism. A big part of that has to do with police relations with the minority community. Police reforms in Jersey City, what progress have you made? What still needs to be done?
Yeah, well, let me start with what needs to be done, because I think that that's like a big opportunity for the state of New Jersey. And most of the changes, and I don't think a lot of the activists and public understand this, that most of the changes that need to be driven forward can come from the state of New Jersey, because most municipalities don't have the ability to do that. So there's a couple things that I would point to specifically that Governor Murphy and the Attorney General can change with a stroke of a pen and have a meaningful impact on municipalities across the state of New Jersey. First is civilian community review boards. I think that the opportunity to have civilians hold the police departments accountable is significant. Today, it's not allowed in the state of New Jersey. Newark tried to do it, but this can be corrected, and it is a healthy thing to have a checks and balance regardless of the circumstances. Number two, I would say that the discipline and how discipline is rendered in police departments is important from a transparency standpoint to be changed. So for me, as an example, if a civilian files a complaint, a use of force complaint, let's use that as an example, against somebody in the JCPD, the process goes to the chief of police, who has the ultimate decision on discipline, and there's no transparency, even to me as an elected official. The only way I'll find out about that is if there's a lawsuit and ultimately I'm named in the lawsuit, then I'll get access to information. But chief executives in New Jersey don't have access to that information. Only uniformed sworn officers at the highest rank, which is the police chief.
Mayor, let me follow up. Is that largely because of the agreement that the police union has struck with the city?
No, that's across the board. You know, if you talk
Anywhere
to the
in New
mayor,
Jersey.
yeah, if you talk to most or no mayors have direct visibility unless the police chief is willing to allow them to have direct visibility, and that's actually a problem. So I don't see the complaints. It goes through internal affairs in the police department. They're protected through that process, and ultimately the chief of police has the ability to render discipline. That's a big problem. Would that only be
changed? Sorry, Steve. Would that only be changed, Mayor, through legislation?
Yeah, I think that police officers and the chiefs in New Jersey have a thing called the Chiefs or Police Bill of Rights. It's out of Trenton. And if you think about that, it's counter to the way policing should be approached. So
is there something called Citizens Bill of Rights?
No, my point exactly. So there's a document down in Trenton that allows police officers to have special protections with regards to what the public can and can't do. And if you think about that from a police officer's or a public standpoint, a police officer is trusted with the awesome powers of policing, opportunity to carry a gun, a baton, with a gun and a badge.
With a gun and a badge.
They should have more scrutiny, not documents protecting them ultimately. So that's something that needs to be changed. And then just the third thing I would highlight, or the fourth thing, because you added another one in Trenton that needs to be changed. In New Jersey, you have, I'll add another one after this. I just thought of it. In New Jersey, you have
a minute left. Go ahead, Steve. Go ahead.
All right, in New Jersey, you have a process where civil service, from a ranking standpoint, protects officers at a higher level. In most departments, they serve at the will of the mayor. And in most municipalities in New Jersey, police chiefs actually have a contract, long-term contract that could be counter to the mayor. That's why you see in a lot of municipalities, police chiefs and executives, mayors that have been elected colliding. And that shouldn't be the case. It's the mayor who's accountable to the public because they're elected. And they should have the flexibility for police uniform leadership that they choose to further that agenda that the people trusted them to do.
Mayor, I know there's another police reform that you wanted to talk about. Could you make sure you join us again very soon, pick up this conversation? We'll also talk more about shelter in place and other COVID-related issues as you join us in 2021. Mayor Fulop, Jersey City, thank you so much.
Thank you.
I'm Steve Adubato. Thanks for watching. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Robert Wood Johnson Foundation, the Northward Center, MD Advantage Insurance Company, the Russell Berry Foundation, Johnson & Johnson, Valley Bank, ADP, Fedway Associates, Inc., and by the Adler Aphasia Center. Promotional support provided by Jaffe Communications and by CIANJ and Commerce Magazine.
Choosing a new family doctor can be confusing. Check with your health insurer to see which physicians near you participate with your plan. Find out which hospitals the doctor uses and who covers when the doctor is away. And remember to schedule an appointment with your new doctor in advance to fill out any paperwork without the added stress of being sick.